Welcome back to my channel. Dear students, in everyday life we often come in contact with different skin problems in the form of skin changes due to any infection or trauma. In this video I will tell you about the different types of these skin changes in the form of skin lesions. I will tell you about the basic definitions and the basic characteristics of these skin changes, and I will also show you the skin manifestations of these skin lesions. So let's start. Skin lesions. One of the most important skin lesion is the macule. Macules are the areas of the skin discoloration which are neither raised nor depressed. So in simple words, macules are the flat areas of just change in the color of the skin. Macules are formed in the freckles or the leukocytoclastic vasculitis. You can see the diagram of the macules. Number second is papules. Papules are the solid elevations of the skin which are raised, palpable and have the diameter less than 5 mm. So these are the solid elevations of the skin. Papules are formed in the allergic eczema or the molluscum contagiosum infection. The skin manifestation of papules you can see on the screen. Third one is the nodules. Nodules are similar to the papules, but they have the diameter more than 5 mm. So in simple words, these are the elevations of the skin that have the diameter more than 5 mm. But the different point from the papules of the nodules is that nodules are extended deeper into the dermis as comparison to the papules. The example of nodule is the mole or the infection of erythema nodosum. You can see the diagram of the nodule. Vesicles. Vesicles are the cystic swelling that contain serous fluid and that have the diameter is up to 5 mm. So the small blisters that have fluid in it are the vesicles. Vesicles are formed in the infection of herpes virus infection. The skin manifestation of vesicles you can see on the screen. Next one is pustules. Pustules are similar to the vesicles, but the vesicles that are filled with fluid are called pustules. The fluid in the form of pustule is opaque and yellow. Pustules are formed as in a case of acne. The skin manifestation of pustule is on the screen. Next one is bullae. These are the cystic lesions of more than 5 mm diameter. So the large blisters of the skin that have more than 5 mm diameter are the bulla. These are filled with serous, seropurulent or hemorrhagic fluid. So bulla are formed in case of burn injury. Next one is the wheals. Wheals are the swelling of the skin due to acute localized edema. So the transient edematous lesions, often with blanching or pallor centrally with the surrounding erythema, are the wheals. These are the type of plaque. The examples that in which the wheals are formed are the intradermal skin test or the urticaria. You can see the diagram of the wheals on the screen. Next one is the scales. Scales are formed by the abnormal desquamation of this superficial layer of skin. These are the flaques of the confined skin layer. The scales are formed in the psoriasis infection. You can see the diagram or the picture of the scales on the screen. Next one is the crust. Crust are the derived secretions of the skin. These are formed by the derived secretions. In simple word, you can say these are the dried exudates of the skin. Crust are formed in infection of the psoriasis in the form of impetigo. In the picture of the crust you can see. Purpura. Purpura are the bleeding into the skin. Non-blanching erythema is called purpura. It is found in the cutaneous vasculitis. Next one is the petechiae. These are the red lesions that have the diameter 1 to 3 mm, and due to bleeding they don't blanch on pressure. The diagram of the petechiae is there. Next one is the ecchymosis. These are the large reddish blue lesions that are formed due to bleeding into the subcutaneous tissue. These are also called bruises. The diagram of the ecchymosis you can see. Next one is the hematoma. Hematoma is the palpable fluctuant collection of the blood. Spider nevi. Spider nevi are the skin lesions that are formed consist of central arteriole from which several branches radiate in all directions. When the central arteriole is obliterated by pressure with the needle, all the branches are blanched and refilling starts from the center when needle is removed. So the spider nevi, you can see, this is the manifestation of the spider nevi, and this is the diagram or this picture of the spider nevi. Next one is the Campbell de Morgan spots. These are the red swelling that have the diameter from 1 to 2 mm in diameter, which don't fade on pressure, and they commonly develop on the chest and abdomen with the advancing age. Next one is the erythema nodosum. Erythema nodosum are the red, painful, tender, indurate swelling of the variable size. The size may be from few millimeters to several centimeters, mainly on the shin. Common causes in which the erythema nodosum are formed are the primary tuberculosis, streptococcal infections, and the sarcoidosis. The picture of the erythema nodosum you can see. Erythema marginatum. Erythema marginatum, these are the transient pink patches mainly on the trunk, which join to form large areas with the pale center and are one of the major criteria of rheumatic fever. Erythema marginatum, you can see the picture of erythema marginatum. Next one, the most important key point of this video is here. You can see this is very helpful for you. In this you can see this is the limit of the 1 centimeter. The skin lesions that have less than diameter of 1 centimeter are the macules, papules, vesicles, and the pustules. And the skin lesions that have the diameter from more than 1 centimeter are the nodules, bullae, patches, and the plaques. I hope this will help you very much. So this is all about the skin lesions. Thank you very much.